Hello everyone, welcome to Radiology Case Review Series. In this video, we are going to look at images of an elderly female patient who presented to the emergency department with abdominal pain. Clinical team ordered CT examination for further evaluation. Let's look at the CT images. As I scroll through the axial CT images, we can see dilated small bowel loops, which is concerning for small bowel obstruction. The distal small bowel loops appears decompressed. The large bowel loop appears decompressed as well. So in terms of the transition point, as I scroll down further, we see dilated bowel loops in the pelvis, and as I keep scrolling down further, we can see a bowel loop which is herniated between the pectineus muscle and obturator externus muscle. Similar findings are seen on the coronal reformats. We see dilated small bowel loops, and we see the herniated bowel loop in the left groin. The bowel wall enhancement is preserved. There is no nematosis. There is no free intraperitoneal gas. Imaging appearances are consistent with obturator hernia. Obturator hernia is a very rare hernia seen in less than 1%. The hernia is more common in female patients, particularly in elderly female and post-pregnancy patients, owing to the greater width of the pelvis, larger obturator canal, and increased laxity of pelvic tissues in females. This condition is also nicknamed as little old lady's hernia, as it affects elderly female patients due to atrophy and loss of the preperitoneal fat around the obturator vessels in the canal, predisposing elderly females to the hernia. In terms of clinical presentation, the symptoms are vague, which leads to delayed diagnosis and complications. As we all know, currently any patient who presents to emergency department without an obvious clinical diagnosis undergoes CT examination, and CT has a very high accuracy rate in terms of diagnosing obturator hernia. As we saw in our patient, the hernia classically is between the pectineus and obturator externus muscle. Initially, it was thought that the hernia is seen only on the right side, as the sigmoid colon prevents the hernia on the left side. However, this is not true. Based on my literature review, it looks like the hernia can be seen on both right and left side. Indeed, in our patient, the hernia was on the left side. I hope you found this case of obturator hernia interesting and informative. Thanks for your attention.